Hi everyone, welcome to week 2 of your evidence-based practice course. You did a nice job with the week 1 DQs. I thought they went really well, and now we're ready to jump into your EBP projects. If you do notice anyone outside my window, I do work in a school for developmentally delayed individuals, and we also hire them to help with things like cleaning, so no worries. Anyway, okay, so let's look at our objectives for this week. Analyze current practice versus research to recognize a need for change. Assess stakeholders, team roles, and leadership skills needed to bring about a change. And then create evidence-based practice objectives which are aligned to measure outcomes. So all of these areas are in some way related to either our DQs or our assignments this week, okay? So let's start with the DQs. So the first one asks you to post your PICO question in the main forum. It's time to bite the bullet and really pin it down. So a basic template is in your text in box 2.1, and there's more information in the appendices and of course in chapter 2. A few points. So in chapter 2, we talk about a background question and a foreground question. Don't confuse the two. We're looking for a foreground question to use for our PICO question for the EBP project, okay? And then make sure that your EBP is actually within nursing's scope. You should not be exploring a medical treatment, such as comparing two medications, okay? It should be something within nursing's scope. All right. Second discussion question. In this one, a lot of the information is provided in your text about how strategies you're going to use to analyze, right? For this question, you don't need to do an exhaustive list, but if everybody contributes a little bit, we'll be in good shape, okay? So that one's not too bad. More listing. On to the assignment. So each week, you'll be working on components of your final evidence-based practice proposal, and we're going to be going about them in a logical manner, step by step by step, until the end you get to put it all together into one big proposal, okay? So we'll start with section A, your first assignment, organizational culture and readiness assessment. Your goal is to determine how ready your organization is to embrace evidence-based practice. Remember that this setting should be a real place that you're familiar with. It doesn't have to be where you work presently, although that can be helpful with gathering information later on down the road. But it just has to be a real place that you're intimately familiar with. It could be a prior place where you worked. It could be where you're doing your practicum. It could be a place you presently work. Just something that where you're really familiar with the organization and the setting. So in order to assess readiness to embrace EBP, you've got to know what areas to look at, right? So in the back of your EBP textbook at the very end, there are several EBP readiness/culture surveys. So you should look at them and use these concepts to assess your organization's readiness to embrace EBP. You're also welcome to use any other tools that you find in the literature. That is just fine. So when you're using a survey or tool, you're going to be identifying areas that you rate as the organization's really good in these areas and not so hot in these areas. And that's going to lead you to determine possible barriers and facilitators to having your project actually accepted there. So please read through the assignment directions very carefully. You want to go through, make sure you got each point. Oh, and also the rubric. The rubric is very descriptive in each of the boxes. Okay. Yes, the 250 word count is firm. Part of what we're doing in the Masters of Nursing program is we need you to be able to communicate in a professional and concise manner. Your analysis of the barriers and facilitators, that's probably going to need maybe 1 or 2 references. so you should look at that. You don't need to submit any of the actual surveys that you use. That's to give you kind of fodder ideas for assessing your organization. Okay? So that's the first assignment. The second assignment is the biggie. Section B, problem description. So before you can propose an evidence-based practice, there has to be a problem that needs to be addressed. That's kind of the whole point, right? Clinical problem, we want to fix it. So you need to be convincing about why this is an issue of concern. And you're going to be using a few different terms. So let's just be clear about what we mean by some of these terms in the assignment directions. Let's say this is your PICO question. In school-aged children with asthma, my population, does a nurse-led education module, the intervention, decrease the number of sick days, outcome, during the winter season, time, compared with no nurse-led education, comparison. Okay, so it's in school-aged children with asthma, does a nurse-led education module decrease the average number of sick days during the winter season compared with no nurse-led education? Okay, so then you're also asked for the purpose. So we're going to twist that around a little bit. What's the purpose? To determine if a nurse-led education model will decrease the number of sick days during the winter season among school-aged children with asthma. You're just twisting the perspective a little bit. And then what is our objective then? Also in the directions. To measure average number of sick days among school-aged children with asthma during the winter season before and after implementation of a nurse-led education model to determine if implementation of the intervention will decrease the number of sick days. So that's kind of quantifying what we're looking at for outcomes. Okay? All right. I know it can be a little confusing, but hopefully listen to that once or twice, and then you'll be fine getting that sketched out in your paper. You're also going to be providing an initial reference list. Should be 4 to 5 sources, okay? Because this will give me and you an idea if there's enough evidence out there to support pursuing your PICO question, right? Because we can't do an EBP if there isn't the E part of the EBP, okay? So I know both assignments together are kind of a tall order, but now is the time to fish or cut bait. You've got to really narrow it down. If you have specific questions about your PICO question or your overall topic, either send me a note in your individual forum, send me a text, and we'll schedule a time where we can kind of talk it out a little bit. Because often the hardest part of this project is narrowing down your topic and being really specific. All right, a few last suggestions. Whenever you find an article on your topic, create a reference for it. The actual APA reference and a little note about what it's about. Some people use a free program, a free form of a program called EndNote. Some free type it in a Word document. Some take screenshots. Some use old-fashioned 3x5 cards or 4x6 cards. Whatever floats your boat. But it is a pain in the butt to think, oh my gosh, I read something about that and I didn't think it was important, and now I've got to go back and find that article. Ugh, it's miserable. Trust me, I know. Okay, our course, the information our course provides you with access to a lot of really good resources, databases and such. So don't limit yourself to just Google and the basic articles in our library. Use the resources that you've been given. They're very helpful. If you get really stuck looking for information, under the library option, under a tab, I think it's the How Do I tab, there's an Ask the Librarian option where you can ask our librarians questions. And they actually get back to you fairly quickly, so you might want to think about that. All right, I think that's about it for now. The time has come to determine exactly what you're going to do for the course. Okay, guys, I wish you best of luck, and I'll see you in the main forum.